everyone, it's Felicia here. Welcome back to my channel. As you should already know, I'm doing a nurse spotlight, and today it is on Marissa. She is one of our day nurses. I see some Cali, of course, of them interacting, and I'm not gonna get too much into it because it's gonna be fun. Marissa does a lot of arts and crafts with our girl, so when you see her gallery of art, that is Marissa.
Thank you.
Yes. So we're gonna get to know Marissa about why she became a nurse and a little bit of the history and more like about home health. And our goal is just to educate others on what home health looks like. So stay tuned because here we go.
Nursing was in my DNA. Both of my grandmothers that I've never met were nurses. I have a great aunt, and my aunt is a nurse, and my mom is also in the healthcare field. I just felt this like strong desire to kind of follow in the footsteps that they, paved out, and I really appreciated, and I saw like the relationships that they had with their patients, and I knew that I had a lot of love to give, and I always enjoyed caring for people. So I decided to become a nurse.
And I wanted to share a quick story about kind of like how we got introduced to Marissa. So when we were in the hospital, we were ready to get home, and finding nurses can be hard. And we were also in a pandemic. So me and Rome created a video. We had a little picture of Cali in there, and we just spread it like wildfire. And I went through Instagram and found different nurses. And one nurse I found said she would share it to a Facebook group. And you were part of that Facebook group.
Yeah.
But you were also working with a family who has a daughter who has Pfeiffer syndrome. And that individual reached out to me.
Yeah, because I think she had showed me back in January when Cleo was born, oh, look, there's a little syndrome sister. And I was like, I want to work with them. And then I saw your video, and as soon as I saw the video, I had messaged the nurse that shared it. And then I went to work the next day and told the family I was with who, I was like, you need to reach out to Felicia, because I was just ready for that transition as well to take on a new patient, and I was moving further away, and it worked out.
It's just like it was meant to be.
Yeah.
And so in that same day, I got a message from the other nurse saying, hey, there's someone commenting on your video that wants to connect with you, and she shared your name. And then the individual who has a daughter with Pfeiffer syndrome, she reached out in my Facebook DMs. I'm like, it's the same person. So we got on the phone and we talked, and it was just like, and I did some Facebook stalking too. And I was like, okay, she's cool. Like, all right, bro, I think we got a winner. And it worked out, and we ended up like, all of them just kind of fell into place. But it's just a fun story to tell because I feel like you kind of have to get out there and be proactive and share your story, because I know when you're looking for families, it can be a little, there's no picture, right? It's
you just get like the plan of care and to find out, what the kiddo's diagnosis is and the types of care you would be providing, which can be a little bit difficult if you're kind of like that person vibes feeling of how you think you'd work with that family. And I think the same goes for the nurses as well. And it's not to judge of any kind, but it's just, you could go through meeting so many different families and so many different nurses until you really find that one that just connects with you guys on like all levels, So
yeah, and that was new for me. I kind of thought that it was gonna be like when you're applying for a job, you know the company, you can do research, and so I kind of felt like they were gonna share a little bit more about Cali, but I get you can't share too much. But without sharing it, it's like, oh, I feel like if someone heard our story, we would have more people applying. So that's why I was like, I'm just gonna take control of this whole situation and share it. But
and then you saw this cute baby, and you're just like, yes,
right?
I want to snuggle this cute
Exactly.
baby.
Oh, and I remember, I think in our interview, you said, do you mind if I hold her? Can I snuggle her? Can I rock her to sleep?
Can I snuggle her?
And I was like, yeah, you can. She'll love it.
Home health, the one big thing is people think it's more so towards elderly or patients that are in that transition to passing, and that's not the case at all. So when I tell people, oh, I'm a pediatric in-home health nurse, they're like, oh, like, I'm sorry that you have to work with kiddos that are in this like really fragile state. And I'm like, what do you mean? Like, my kid, she's wild every day. Like, she is here, she's thriving. Like, I'm here to support her, and she teaches me a lot of different things about myself and how I can be a better nurse as well. And if people would just really open their eyes and kind of see that in-home nursing is not this sad part of life, but a really exciting and new beginning, especially for these kiddos. It's just changes you, it really does. And something else is that I know, I guess a lot of nurses also are maybe not as educated as what it means to be an in-home nurse, and I wish they could do a little bit more education for themselves to see that, sure, you guys work in a hospital and I work here, but I'm also doing the same task that you guys do in a hospital just at home, you know. In pediatrics, these kiddos come from Seattle Children's and other children's hospital, but they're just needing care in a different setting. So I don't think that makes us as nurses any different. No, there's just so many different memories that I have with her. You know, just the memories of us singing together, and she's definitely a very like routine person, and how I do things might be different than way, you know, you and Rome might do something, and it's so funny just to see like when you guys talk like Marissa, you know, do Marissa's voice, and she knows like that's not Marissa doing and I just think that's the funniest thing. But you know, we have tons of memories. I mean, I don't know, every day is just an adventure, and I appreciate, you know, you guys letting me come in here and like be a part of the family and make all these new memories with you guys and Clea.
My favorite Marissa moment, okay? So as I told you earlier, so we went, our friend has a house on Lake Washington. They have like stairs, a dock, and so we're there. Marissa brings the tent and everything. Callie's got this little like waiting, like little like floaty thing that she can sit in. We got the vent strapped to our back. And that's one thing you did, you found the strap. So it was like a backpack. Yep. So we're out there, and then the wind just blows. And one of my friends is like, you guys, and we're like, what? We're in the water. And she's like, your tent, and we look, and the tent is in the water. It's gone. And we were like, ah! So Rome like dives in the water to get it, but he didn't realize like all of our stuff was in the tent. So it was so heavy.
Things are like floating out too.
Yeah, he was like holding on to the pole. He's like, okay, this is some hard work. Like, and Marissa's like, do you need help? And he's like, yeah. And she just straight up.
I ripped the mask off, because then he was like, that's the first time I've seen your face. I ripped the mask off and I'm like, here we go. I jumped fully clothed, shoes on, in the water.
Yeah. And I was like, that's a real one right there. She's like pulling stuff.
Grabbing the to-go bag, like everything. That was just...
That was hilarious, but that was one of those moments. Like, you not get that in the hospital. No. So we've got some fun moments.
She is stubborn at times. If she doesn't want to do anything, good luck trying to get her to do it, because she won't. She's very resilient, you know. She's had a couple complications in the past, but she has bounced back in full force, you know. Just getting out of the hospital, she's back in her bouncer, you know, just doing her thing. And she is very smart. She is a smart girl, and she has a great future ahead of her, and she is going to do things that you won't even imagine. So those are, I think, the best 3 words that I can use to describe her. 5 years, okay. So right now I'm at the UW in their doctorate program to get my pediatric nurse practitioner's, you know, Doctor of Nursing Practice degree. So I have 2 more years of that, and I'm hoping that in the next 5 years, everyone is going to bring their kiddos to come and see me as their nurse practitioner. I don't know, like maybe I'll be in a clinic, maybe I'll do some more public health nursing. I'm not really sure. I just know I'm going to be done with school. Yeah, and just starting that new pathway and career as a nurse practitioner. For parents, like, you know, just really trust your nurses and make them feel comfortable, but also this is your home, and we want you guys to resume life as if you don't have us in your house, you know. And I understand it's a super big change, but for myself, I really like families that are very communicative and hands-on, and I will give you the opportunity, you know, because this is your baby, you know, this is your kiddo, and I will let you guys take whatever role that means to you. If you guys are wanting to do all the feeds, you know, trait care, things of that nature, but I will also be there to assist you. I might give you that little push being like, okay, you're gonna do it this right now, but it's coming from love, and just so you guys are knowing that, hey, I need to be able to do this too, and you'll thank me later. But yeah, I know it's a difference, you know, you're coming home with a baby, you have a medically fragile baby, now you're having these strangers essentially in your house, but it'll all work out in the end.
All right, well, if you made it to this point, you've watched and listened to Marissa's story, and she's such a big part of our family. She had a handful of things that I totally agree with, like, you know, making your home welcoming and getting to know your nurses. That was one thing. We were nervous at first, like, okay, we have new people in our home, like, what's this gonna be like? Can we be ourselves? But picking a team that we had this, like, this energy, this vibe, I'm like, okay, she's gonna fit well with us, and it doesn't even feel like doesn't feel like we have strangers in our home.
No.
You know, when you're coming, you're like, all right, Marissa's coming, Jessica's coming.
I feel like I've known you guys for years, and I'm just coming to hang out. You know?
It's so true. Thanks for tuning in, y'all, and like I said, I'll come back with some more videos, and Marissa, appreciate you for hopping on here and, you know, everyone getting a chance to get to know you.